One way that oral posture and oral movement dysfunction can present is in the impairment of speech, specifically in the pronunciation of S's and Z's in the form of a lisp. A lisp is when, specifically an anterior lisp, one of the most common forms of a speech defect, is when the anterior tongue, or the front part of the tongue, touches the front teeth during the pronunciation of the S or the Z, or the tongue sits between the teeth. So a dentalization of the S or an intradentalization of the S. From an oral motor background, this can be caused from various sources. Specifically, it could be that the tongue has limited range of motion due to a limited, tight restricted frenulum underneath the tongue that's holding the tongue in place. It could come from just a low resting tongue posture, as well as impaired tongue coordination and or an anterior tongue thrust. Now, if you're working your way through these videos and you're starting to realize that this is not the only presenting sign that something may be off in terms of oral posture and oral motor, then add this to your self-assessment form. Make sure you circle that a lisp is present. And then what I highly suggest is reaching out to a speech pathologist who is also a myofunctional therapist in your area. It is quite common for these two professions to start to overlap now. So what I would do is, if you cannot find one of these very special individuals, I would reach out to both a speech pathologist and a myofunctional therapist in your area to get an assessment on yourself or your child if you're noticing that not only do they have a lisp, but there are some other oral motor issues going on. The reason I would recommend both is they both come from a very different educational background and will have a very different assessment. Most likely will have a different assessment and treatment approach. And you'll likely benefit from both sides of the coin here. If you have any questions about a lisp or any of the other assessment videos that we've gone through so far, please write your question in the comment section below. Find me at summerspt.com or reach out to your local myofunctional therapist. If you'd like a full myofunctional therapy self-assessment form to follow along, then you can click the link below and enter your email address, and a full myofunctional therapy self-assessment form will be emailed to you.